Hey guys, welcome back to our YouTube channel. In this video today, I will inform you what the color of urine says about your health. So, stay with us throughout the video. Now let's get into this video. But before starting the video, don't forget to subscribe to our channel and hit the notification bell icon so that you may not miss the upcoming video updates. What the color of the urine says about your health. Urine has been a valuable tool for the diagnosis of multiple diseases since ancient times. It tells a lot about the overall health of a person, from hydration level to any abnormalities or infections in the human body. Urine consists mostly of up to 95% of water, but it also contains a lot of other ingredients such as chloride, urea, potassium, sodium, creatinine, and multiple other organic and inorganic components. Different colors of the urine indicate different underlying conditions. Each color can represent multiple things, so you need to see the doctor to confirm your specific condition. What should be the normal urine color? The normal and most common color of urine is mild yellow, that is the result of the presence of urobilin, which is a biochemical waste product produced after the breakdown of old red blood cells. A normal human body creates almost 2 million new red blood cells daily and recycles the same number of old ones. The intensity of color also depends on the concentration of urine. Urine is a mix of different components like water, electrolytes, and wastes that are filtered from blood through your kidneys. As urine normally contains yellow pigments, so when a person is hydrated and healthy, the color of urine should range from clear to pale yellow. In case if you are not consuming enough liquids and your body feels a bit dehydrated, urine color can change to a darker yellow or amber color. The color might temporarily change as a result of certain foods you eat, laxatives, antibiotics you take, or a mild medical condition. Sometimes an abrupt change in your urine color might be due to a medical condition you need to address. Different urine colors and what they indicate. As I said earlier, the color of your urine is an indication of what's going on inside your body. It can vary as per your diet or in case you are on certain medications. A range of these colors falls under the normal conditions, while other colors direct you to see a doctor as soon as possible. Let's see what these different colors indicate. Clear or transparent. Transparent urine might be a sign of overhydration, although it's not as dangerous as dehydration. Occasionally this condition can dilute essential salts, such as electrolytes, that lead to a chemical imbalance in the blood. So, if you are drinking too much water for a longer period of time, you might need to step back a little to keep things normal. Occasional clear urine is not a big deal, but if it's consistent, you need to cut back on your water intake. In some cases, clear urine might be an indication of liver issues like cirrhosis and viral hepatitis. If you are drinking a mild amount of water but the color of urine is transparent, you might need to see a doctor. Pale yellow. When everything is in perfect range, the color of your urine should be pale yellow or gold. You should pay attention to your urination to monitor what normal color looks like. It can be a useful practice because if there is a change, it would be easier for you to figure out. Bright yellow. The bright yellow color is harmless and is just an indication that you are taking more vitamins than your body's requirement. You should consult a doctor to know the optimum range of vitamins, so you can cut back if you are going over the range. The dark yellow color of the urine might point out that you are suffering from a severe infection, underlying kidney disease, or dehydration. Mild conditions or medication that affects the kidney and liver can also sometimes cause this color. Don't forget to consult your doctor if you have dark-colored urine, and it does not go away with time or drinking a lot of water. In severe cases, it can be an indication of a chronic condition, so do not avoid it, because if you do, you can suffer from consequences that could have been easily eliminated if you have addressed the issue in time. Brown. The brown color of the urine is a sign of severe dehydration or liver disease. Drink plenty of water, and still if the color remains the same, consult your doctor. If you are suffering from melanoma skin cancer, a skin pigment might be adding up in circulation and eventually going into liquid waste. This color of urine can be due to the consumption of foods like aloe, rhubarb, or fava beans. Certain medicine like metronidazole used to treat infections can also cause this color. Red or pink color. Red urine can be a serious concern. Most of the people who see red color in urine get scared, although it can be a sign of a serious medical condition, but that's not always the case. Red color does not necessarily mean that you have blood in urine, but it can be due to pigmentation or colorants in medicine or food. If you have eaten a certain red-colored food, like berries, beets, or rhubarb, there is nothing to worry about because it will return to normal within a day or two. On the other hand, if you don't remember eating such food but your urine is red for a longer time, see a doctor because it can be blood that indicates a severe infection, tumor, prostate problem, or damage to kidneys. It can also be a sign of mercury poisoning or kidney stones. Rarely, it can be due to an inherited disease called porphyrias. So, the red color is an alarming sign and you need to rush to your physician. Orange. Orange-colored urine indicates that you are dehydrated and need a lot of water. It can also represent a liver or bile abnormality because when bile starts to enter your bloodstream, it causes orange-colored urine and is a clear indication that something is wrong with your bile duct or liver. Certain foods like carrots or carrot juice can also cause orange-colored urine. Medicines like phenazopyridine used for urine relief. High dosage of riboflavin, sulfasalazine, an anti-inflammatory drug, or some laxatives can also be responsible for this color. If the color of urine is dark orange, it represents jaundice. If this condition prevails, see your doctor and find out details. Blue or green. This is a strange color and is not seen very often. It can be simply due to certain food dyes. Occasionally, this weird color might be due to a rare inherited metabolic condition called familial hypercalcemia or blue diaper syndrome, which is caused by the incomplete breakdown of a dietary nutrient, tryptophan. The blue color of the urine can be due to bacteria causing urinary tract infections. Medications like painkiller indomethacin, the antidepressant amitriptyline, or anesthetic propofol might cause blue-colored urine. Dark brown. Generally, the dark brown color of the urine might indicate that you have eaten fava beans, rhubarb, or aloe, or it can be due to dehydration and there's nothing to worry about. But an alarming thing about this color is that it can be due to melanoma, copper, or phenol poisoning that leads to a blackish urine color called melanuria. Dark brown can also result after taking medicine like metronidazole and chloroquine. In some cases, an abnormality called porphyria that causes the accumulation of chemicals in your blood can also be the cause behind dark brown colored urine. Purple. The purple color of the urine is due to a condition called purple urine bag syndrome. The reason behind this condition can be the use of a urinary catheter when the person is already suffering from a urinary tract infection. Cloudy. It's usually not a serious issue, but in some cases, it might be an indication of mild urinary tract infection, accumulation of certain minerals like calcium, phosphate, or a kidney disorder. If your urine is cloudy with bubbles or foam, it can be a sign of Crohn's disease or diverticulitis. Some medications can also cause a cloudy appearance of the urine. Another reason might be that you are on the keto diet and eating a lot of meat. Smelly urine. The color of the urine is not the sole indication of any disease or abnormality. You should also pay attention to the smell of urine because it can be due to a range of abnormal conditions. The smell can be simply due to the last food you ate, like asparagus can cause smelly urine. Try to eliminate such foods first, and if the condition continues, you should consult a physician. Containing blood. Another serious condition that indicates an abnormality in your body is the blood containing urine. It's not like it would be a complete blood red color. Instead, it is the parts of blood mixed with urine. It can be easily spotted, and you can distinguish it from the red-colored urine that appears after eating dyed food. Blood in the urine might indicate a temporary cause, but still, it is the reason to see your doctor, especially if blood appears frequently in the urine. On the other hand, this can point out a serious underlying condition. If you are vigilant about your urine color, you can make sure that any irregularity is easily spotted and treated. The color is not the only significant feature that shows an abnormality. Certain other things like frequency and consistency also indicate a change in normal behavior when you visit your physician. Don't be afraid to pee in the cup when asked, because it tells your physician a lot about your body functions, and in certain cases, it can be the first indication that something is not right with your system. When you should see a doctor, changes in urine color can be mild and temporary, basically resulting from food colors or intake of certain vitamins or medicine. These color changes might point out a serious medical condition. Whenever you notice a color change in your urine, first think about the last meal you ate. And if it did not contain anything unusual, but you notice a different color, it's time to seek medical advice from the doctor. This becomes more important if the color change prevails for a longer time period, or if it is accompanied by side or back pain, high fever, burning while urinating, or vomiting. Seek help from the doctor if you observe any of the following. Blood in urine. This is pretty alarming as parts of blood and urine show an underlying urinary tract infection or kidney stones. These medical conditions mostly cause pain, but if you can see blood in your urine, but there is no pain or discomfort, it might be even serious. Like this condition can be an early sign of cancer. Dark yellow or orange urine. If your urine is dark yellow or orange colored, especially if you have pale stools and yellow eyes and skin, it might be a hint toward liver malfunctioning. Causes. The most common cause of differently colored urine is food or food dyes, while in other cases the color might point out a serious medical condition. Colors may seem different to different people, so you need to consult a professional for proper guidance. Common risk factors. Apart from different foods, vitamins, and specific medication, discolored urine can be a representation of serious health problems. There are certain risk factors that determine how susceptible you can be to these different health issues. These factors include age. Age is the major risk factor for a range of diseases. For example, tumors in the bladder or kidneys, which cause discharge of blood with urine, are most common in elderly people. Men older than 50 years may have urinary blood due to enlarged prostate glands. Genetics. Your genetics also determines your medical conditions. If you have a family history of kidney stones or other related kidney diseases, you are more prone to develop such conditions. Both kidney stones and kidney diseases cause blood in the urine. Vigorous exercises. People who do strong and persistent exercises might be at risk of urinary bleeding. Drugs. People who continuously consume alcohol or drugs like marijuana or other substances are also at risk of developing certain conditions that lead to the change of urine color. Conclusion. You can learn a lot about your health by simply paying attention to your urine color. Do not hesitate to go to the doctor if you feel an unusual color or smell. You should not avoid any abnormality in your urine because if neglected, these minor symptoms can lead to a serious medical condition. For instance, higher sugar levels in the blood can be a sign of diabetes. On the other side, blood in urine indicates a severe underlying condition like cancer or urinary tract infection, but in most cases, it cannot be predicted without proper tests. To reach an informed conclusion, you should see a urologist as soon as possible. Thanks for watching our video. Don't forget to like the video, subscribe and hit the bell icon for notifications from our channel.